And this is what a testing kit looks like. It's got all this junk in it. This is not going to be here. You're going to have pills in there, and then like pills like this with a label on it. Okay, so what you're going to, and this paper will be here. The syringes and everything you have to select on your own, and you need to know the sizes of what you're going to, if you're going to give sub-Q, you need to know what size needle you want to get, what size syringe. And you're going to get a piece of paper like this, and it's going to be blank, and it tells you to rip it apart, turn it over. You're going to see there's the doctor's order here, and this is the MAR, the MAR, and that's a medication administration record. And it has all the medication. Now, everywhere now is going computer, but this would be on computer. And what it is it has all the medications from the doctor's order. Now, the doctor's order has the admitting diagnosis here is hepatic cirrhosis, has the allergies, the activity, the diet, the IV, the x-rays, and then it starts with the drugs and ends with the drug. So the drug orders are going to be on this piece of paper, and this is for Elizabeth Hernandez. And up here it says Elizabeth Hernandez. So you're going to have a box that says Elizabeth Hernandez. It says Joan Van Hart, but I'm just showing you that it's going to match. And so I'm going to come over and I'm going to indicate to you which 2 drugs you're going to give. You're going to give an oral preparation. So in the last 2 classes, I talked about Cataflam. So I'm just going to pretend that this is the Cataflam. Where's that one little pill?
It's beside that.
Oh, here it is. So you're going to use this white piece of paper to do your calculation. So if the Cataflam is 100 milligrams and you verified the order here, here's the Carafate and the Cataflam order. You have to make sure that these 2 drugs are correctly written on the MAR. If they're not, you're going to tell me. Then you're going to start calculations. So we want X tablets. The doctor's order is 100 milligrams. The capsule says 50 milligram per cap. You do your math and you get 2 caps. So we know we're going to give 2 of these. Then for the Clafuran, you're going to go, and there's going to be a variety of pills because I have about 8 different patients. And I bring 2 of you in at a time. And so I'm going to set you up with a piece of paper. You each have a different patient. And so because there's so many different drugs, I can pick and choose for you to give 2. You have to give an oral med and 1 injection. So you need to know intradermal, you need to know sub-Q, and you need to know IM, the 3 types of injections, because you don't know what you're going to pick. So here is Clafuran. Isn't there somebody missing? 3, 6, 7, 8, 9?
And Kelly. And Elsie, right?
Mm-hmm.
Oh, Kelly and Clarissa were here this morning. And who else?
Elsie, I think. Elsie?
Elsa. I didn't see
Elsa
her.
wasn't here today.
No, I didn't see her.
I'm recording it though.
Okay, Clafuran, 500 milligrams. And the doctor's order is Clafuran 1 gram. So in setting it up, it's X milliliters, 1 gram over 1, times 1,000 milligrams over 1 gram. And this is 500 milligrams per 1 milliliter. So when you do your math, your final injection is going to be 2 mils. So I come over and I check everything. And if I see that, okay, you calculated wrong, you stop the test, you fail. Okay, so you have to have your calculations right. Okay. I thought you were here this morning, so you weren't coming back.
No. Of course, we would never miss you. Long story.
Okay, so you have your, now that you have your math is correct, I say, okay, go over there and get your stuff. You're going to get a little tray. You're going to get, grab that thing for me. You're going to get a little cup. Reach back there and get me a cup, Nat. Medicine cup. And you're going to start preparing your meds. You're going to have your 2 capsules in here. I only have 1, but you're going to have 2 because you're going to be giving your med in that. And then you have a 3 milliliter syringe. Now, unfortunately, this says Clafuran IM Z-Track. So you have to have a 3 milliliter syringe. So, and you need to have 2 needles. 1 to draw off the medication and 1 to change out the needle. So we're going to get, remember that we need 1.5-inch needles to give this med. You get your alcohol, you get your gloves, And so, this looks used. It was used. Ew.
Discount hospital.
Not that discount. So you're going to have the things that you need to do the draw and to give the med. So you don't need 1,000 of these, you only need a few, okay? And you have 2 needles, one to drop the medication and one to change before you give it to the patient.
Are they the same though?
Yeah. It should be 1.5-inch needle. There's a paper that I gave you with everything printed on it, the sizes of the needles.
Oh, the one I didn't get.
Huh?
The one I didn't get. That's not
You didn't-
important.
Oh, I forgot about that one, yes.
I'll send you a picture.
There it is.
Which one? This one?
Lift it up, that one.
I think I have an extra one.
She does, she has an extra.
Yeah.
She stole it. Okay, so right here it says intradermal, sub-Q, and then the IM injections start here and continue on the back. Now, the intradermal and sub-Q always it's 25, 26, 27, 28. This is a 26 gauge. I've seen them up to 29 gauge. Any of those are proper for giving the intradermal or the sub-Q, are of the same size and length. The sub-Q is 1/4 inch. Okay, that's like 1/4 inch. And you can give intradermal up to 5/8 of an inch. Now, intradermal, remember, is just under the skin, so it doesn't really matter how long it is. Sub-Q, you're thinking about the fat. So if you had a Giovanna here, which has probably no fat on her stomach whatsoever, right? Stand up and come over here. Show me your fat. Okay, so if I use this on her, look at that. Oh my God, I hate you.
Show it off, girl.
So for her, I would use a sub-Q needle about that long for her. And you could either turn it at a 45-degree angle. Okay, so for a bigger mama like me, you use that one. You use that 1/2-inch needle, like I said, still hit fat. You hit it from across the room. Okay, so this is the longest of the needles. Then you get into the IMs. The IMs start at like, think of the legal drinking age is 21. 20 to 23. Okay, so that'll help you to remember that. So 20 to 23 is, and if we go over there and I tell you to select needles and you've got it in your mind, you want a 23, and we don't have any, you're gonna have to use a 21. You have to use what we have. Sullivan stocks it, but not always do we have everything that we need there. Okay, depending on what comes from medical. Okay, so we're gonna get ready to draw this. And so that's the next part of how I watch you do that. And we do this without gloves because we're in the med room. And this is the part you have to do sterilely. You're not going to be playing with syringes that are already open on this test. And Monday, I'll be here from 9 to 12 to help anybody out. It'll be open lab. So you take this out, and if you place it down like that, that's a fail. So you have to hold on to this.
Repeat that.
Okay, when you take these things out of the containers, you have to always hold them once you get the sterile caps off. Okay, and if you slide oh, that's a fail. Okay, if you do something like that, you have to go get more. So if you contaminate something and you tell me, then like this morning the lights went off and I was trying to recap and I contaminated the needle and I said and I just capped it anyway, and then I said, did you notice that I touched the outside of the container? And they said yes, but they didn't say you just contaminated. So I know as a nurse, contaminate, you can always change the needle out. It doesn't hurt anything.
But if you give the injection and you contaminated it, you fail, pretty
That's
much.
Right. Snap this
Keep
off.
it in your hands.
As opposed, this is a different packaging. This packaging is like this, and the thing is inside there. The hub is in there. This one has a sterile cover over the hub. You just take it off, and those are garbage. So you can keep your area from put this in your pocket.
So you can set it down after you've put the cap on it already.
That's correct. Okay. Now I'm going to do my draw, and I have 2 milliliters. And with Clafuran, since it's Z-Track, I'm going to get my 2 milliliters of air. I'm going to go into the vial, and this is the part that I watch you. You're not supposed to touch all up in here. And I watch you draw the medication. You got to get all the air bubbles out, and you have to keep it into the bottle when you do it. You don't take it out to get the air out of it. You just draw. You can go past what you need. I can go all the way down a little farther. Now, notice that I'm sucking air because the vial is almost empty and the needle is long, so it's up in the air pocket. So you might have to draw the needle down a little bit if you start getting air before you get your dosage. So now I'm at 2. And I want to put in an airlock for a Z-Track. So an airlock is 2 lines. Okay, and an airlock is when I turn it like this and I go into the mannequin like that, the air is going to clear the rest of the way. And that's important to seal it with a little bubble of air into the pocket in the muscle where you've just put the medication. So I've got my airlock. Now if I draw down a little bit, I'm hoping you'll see it. There might be some fluid in here. So let me, there's a little tiny drop. Did you see it come out?
Yeah.
Okay, so now I'm going to go up with it, and I'm going to change it out. So this is the only time you recap, and you do it by the swoop and the scoop method. And I'm changing out my needle because
That was touching that.
it's been in here, and we want a clean one to go into the patient with the Z-Track.
So Z-Track's the only one that you put the little pocket of air?
Yes. And you can change needles anytime you want to, except for the insulin is a permanent needle. You can't change it.
But the Z-Track is always, you want to change the needle?
Always, because it's a
Whenever you're
medication is very caustic, and it's
And it's on the
very
outside of the needle.
rarely given. It's a technique of sealing the medication in the muscle, and you're always using the ventral gluteal site. Okay, so here we come. This is the only mannequin we can put fluid in. These other mannequins you gotta. So once I see you draw, I'm gonna have you put the liquids back into the container. And then I'm going to see you do it with air into these mannequins. But this one, for just purposes of showing you. I'm going to put my gloves on. Now we're in the room. Hi, I'm Kathy. I'm going to be your student nurse today. And I'm going to be giving you 2 medications. And I've checked the doctor's order. And I'm going to provide for safety and privacy. And I'm going to perform a skill in a safe and effective manner, and then I'm going to document and wash my hands when I'm done. Okay, and I'm going to find the ventral gluteal site, which I'm going to show you that again, and take this cap off. And I had a student once in testing and set that down like that. That's a fail. Okay, so here we go with the medication. We're going to inject at 90 degrees, and we're going to pull the skin. You're pulling the subcutaneous and the dermal layer over. So, and the muscle stays where it is. So we're going to inject straight down 90 degrees. And then it's a one-handed technique. So you don't aspirate like that. It looks retarded. You go like this. Okay, and notice how when I aspirate, notice how it goes back. It's like a suction. So you're not really drawing anything into the syringe. You're just making sure you're not in a vessel. If you were in a vessel, blood would flush up into the syringe here, but that didn't happen. So now I'm going to go ahead and inject. And I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I slid my hands down here so I can have better control than trying to take it out like this. You might drop the syringe and prick the patient. And you count it to 10, you take this out and you release it, and it's sealed over.
At the same time as you're taking out the needle, you release.
Yes, and it goes over and it quickly seals it. Do you see how some of the stuff squeezed out?
Mm-hmm.
Okay, it's a liquid. That's what happens in a real injection. You're going down almost like a volcano, and when you come out, sometimes you've hit capillaries on the way down, so when you come out, you might see a little tiny blood at that site, or a little bit of clear stuff. That means the medication is shot back up and is on top.
What happens if it is in a vessel and you get blood in the syringe?
You abort the mission and start over.
Okay.
You draw a new medication.
Yeah, because you don't want blood to start clotting in the medication and then to inject that into the body so that it has to absorb it.
Okay.
That's not a good thing. And then you're going to document. And so to document, right here, this place here tells you the medication name. This is the scheduled time it's to be given. This is the first shift, 7A to 3 p.m., 3 to 11, and 11 to 7. The clafuran and the cataflam were due at 6 o'clock in the morning, which happens to be on the night shift. So I'm going to write 0600. Now, even though it has clock times here of 7A to 7P, and the clock times listed here are military time. So normally you would have an AM, and you wouldn't have an 1800. That's 6 p.m. So if they have clock time, normally you don't use, but we're going to use in this case the military 0600, 0600, slashing through it with through the time with one line, like up in here. The PPD was given by this nurse, MCF. That was Marie C. France, RN, and MCF is her initial. Your legal signature is I am student SN MDC. Your first initial, your last name, it would be like K. Thomas, SN MDC. If you were at FIU, it would be SN FIU, SNBU for Berry University. So that's your legal signature till you get out of school. And then over here is just the initial. So when you give it...
So you write your whole last name out.
Right, under signature,
Yeah.
not here. And the SNMDC it goes with the signature, not with the initial here. So looking at MCF, I could see all the places on here where she's charted. And she looks like she's probably the day shift. So I would see her signature, MCF, her initials, next to the times. Now, right here is a legend. And the legend tells you where it is. So right here, if we did the right ventral gluteal, that's a C. So notice I put a C here this morning next to the clafuran, because this mannequin here is right ventral gluteal site. If the patient is in x-ray and it can't take their medication, we're going to circle it, and then the med's not given and the reason legend is here. So if the patient's off the floor, we're going to put Q out off the unit. Okay, so that's the last part of this skill. And your overriders, you're going to document, you're going to wash your hands, and you're going to document, and you're done with the skill. Okay, so Ariel, why don't you come and give us a ventral gluteal injection. Let me just reiterate how to find it. This is the mannequin's right leg. There's no femur in this side, so you're not going to be able to practice giving meds in the left ventral gluteal. So for testing, patient's right leg, your left hand finds the spot, and you're going to take two thumbs and you're going to feel for the head of the femur, and it's right there. And you're going to put the palm of your hand on the head of the femur. And then right here, the anterior iliac crest, your pointer finger or index finger is going to go there. You're going to spread this, and it's 1 inch above that. So we're going to find that site. Ariel, hold your hand here while I give this injection here. You're going to find the site. Okay, you're going to mark it with that. You have your fresh needle, your 2 mils, and your airlock. You're ready to go. You pull this aside. You have your gloves on, and you're going to pull the skin, inject one-handed, come up like this, aspirate, inject, slide down, count to 10, 1, 2, 3, 4, 5, 10, then pull out and release at the same time, and it seals over. The ventral gluteal site, I can also give it without Z-Track. Aspirate, inject, two-handed technique as opposed to the one-handed technique from before. Okay, so the last 2 injections are
these are all intramuscular, right?
that was intramuscular. This is the rectus femoris, okay? Rectus femoris is right there on the front, in the middle of the thigh, and the other one is right about like that. We have rectus femoris, vastus lateralis. Given the same technique, aspirate always on intramuscular. The last site that you could use, and I'm going to just look at you, you know, that's up to you where you want to put your injections. But I'm going to look at you and decide which site you didn't practice, and that's the site I'm going to give you to give the test on. I'm kidding.
Practice them all.
Okay, so this is, normally the deltoid is only for vaccines, and you don't give any more than a milliliter in it. The bigger muscles can hold a lot more. So most vaccines, if you'll notice, it says influenza vaccine on it. There's no dosage because the dosage is a half of a milliliter.